we're going to move on to our next speaker, and then there will be time to answer all the questions. But our next speaker is Helen Doyle, and as Linda mentioned, we were looking to have someone speak to kind of a local context within Canada and here within Ontario to be able to talk to some of the applications in a context that may be familiar to many of us on the line. So Helen has a long history of working with climate change and environmental health issues. She is here as the chair of the Ontario Public Health Association's Environmental Health Workgroup, and she contributes to advocacy and healthy public policy on climate change, air quality, and healthy natural and built environments in that context. She's a public health professional with over 30 years experience, and she managed an interdisciplinary team at York Region Public Health, working to improve environmental public health through research, health promotion, partnerships, and policy development, and recently retired, congratulations, in 2018, but has still continued to be very busy. She, in the past, led the development of the York Region Corporate Air Quality Strategy and initiated the Climate Change and Health Vulnerability Assessment for York Region. She currently represents OPHA on the Great Lakes St. Lawrence Collaborative, the Ecohealth Ontario Steering Committee, the OPHA Climate Communications Advisory Committee, and the Rent Safe Project Advisory Committee. She's also on the board of directors for the Windfall Ecology Centre, which is a Green Communities Canada organization. So we're really pleased to have Helen join us today, and I will turn it over to you now.
Thank you so much. I'm very happy to be here today. And I'm joining you from Simcoe County, which is in Ontario, and I would like to acknowledge it's situated on the traditional land of the Anishinaabe people. So I'm going to share some of the public health work happening in the province and at the local level in Ontario. I'm going to talk a little bit about the Environmental Health Workgroup and some of the Ontario Public Health Association activities to address climate change. There's quite a few of them. I'm going to talk a little bit about OPHA's advocacy, some of our communication work and partnerships. And I didn't put it on the slide, but I'll just mention it now for the recording. The website, a lot of this information is on OPHA's website. It's opha.on.ca. I'll also speak to the public health mandate. So Linda showed the public health standards there in one of the earlier slides. I'll speak to that briefly. And then I'll talk about some examples from health units that have incorporated a health equity lens when they're addressing climate change. I'm going to focus it and limit it to just 4 health units, just to give you a snapshot of work that's happening. But a lot's been happening in the last couple of years, and I provided the websites as well. So I selected these because the information is easily available on the website. And I'll also be happy to share with you or pass information along if you have any questions specific to those health units. So the Ontario Public Health Association's mission is to provide leadership on issues affecting the public's health and to strengthen the impact of people who are active in public and community health throughout Ontario. Our Environmental Health Workgroup's mission is to engage in knowledge sharing, research, and partnerships and advocacy to promote healthy environments. And one of our major area of focus is climate change. So OPHA is very active in advocating for health protection and health equitable policies relating to climate change, and there's been quite a few of them in the last 3 years at the Ontario provincial level. And we make sure that when we're submitting comments that we make reference to climate change health impacts, but we also stress the urgent need to address climate change from a health equity perspective as well. So these are just some of the examples of the most recent pieces of legislation at the provincial level that we've commented on, and some of our comments. So we're very concerned that climate change may worsen existing health inequities, and we were also recently, the previous Ontario government had a cap and trade program in place. We advocated for the current Ontario government to keep a carbon pricing mechanism in place and recognize that that could help low-income families. So we wanted to make sure that we were able to express our views on that. Also at the federal level, we had the opportunity to meet with the federal environment minister in December before she attended the climate talks in Poland, and she tweeted about our meeting and our conversation about the very real climate change health impacts. We were able to share some of the evidence on the health impacts, and one staggering example is that 14,000 deaths per year in Canada are attributed to air pollution, and that will be exacerbated by climate change. But we also communicated how climate action can result in multiple positive health benefits, including health equity. To complement our advocacy, alPHA is working with health and environmental partners to develop a health-focused communication strategy. And Linda had mentioned the need to build political power, and we're hoping that we are able to do that through this mechanism. So the communication strategy recognizes that climate change has significant implications for health equity, and we want to make sure that our communication does not increase harm for vulnerable populations by increasing alarm without addressing some of the external factors that maybe individuals or communities do not have control over. And the next three slides are just two examples of research that alPHA has supported through our partnership with Ecohealth Ontario. All of these are on the Ecohealth Ontario website. I didn't put it on the slide, but it is ecohealth-ontario.ca. So the first one is provides examples, this case study provides examples of how biodiversity can increase our resilience to both social change and climate change. The second one was by the Advocacy Foundation, but Ecohealth Ontario and alPHA were advisors on this project. And in this systematic review, it demonstrated that several studies show inequitable distribution of neighborhood green space that is often related to socioeconomic status, and that it may represent health inequities related to heat exposure and air pollution. The next one, a Toronto Public Health report, was also supported by alPHA. This evidence review identified that everyone's health benefits from access to green space, and vulnerable populations benefit the most. And we're obviously linking this to climate change because adding more green space is one way to both adapt to climate change and to mitigate climate change. A couple of years ago, alPHA conducted a survey of the 35 health units in Ontario, and we asked several questions about their climate change activities. The picture has changed quite a bit in the last 2 years, but in 2016, we asked if they were using a health equity lens to address climate change risks. Those that responded that they did use a health equity lens said that they were targeting their assessments and response activities for those living in poverty or homeless, to people living with mental health issues or addictions, and to isolated seniors. And the top health risks that they assessed using a health equity lens were extreme cold, extreme heat, and air quality. So as Linda had mentioned, the climate change is more prominent now in the Ontario Public Health Standards than it was previously. So this is the 2018 Ontario Public Health Standards, the requirement for health units to assess the health impacts related to climate change. And there's also a health equity foundational standard that requires health units to consider health inequities when assessing the needs of local populations. The Ministry of Health and Long-Term Care in Ontario also released a guide, a toolkit to guide climate change and health vulnerability assessment. So this has been quite useful for health units in Ontario as they commence their climate change and health vulnerability assessment. It's a guide to how to identify current and projected health impacts, how to identify populations most at risk, and how to identify adaptive capacity of individuals and communities. I also wanted to mention that health units that are very active on climate change are also getting a lot of support from Health Canada and Environment Canada, some of the tools that they provided to help health units with their vulnerability assessments, and also from peer support. As more health units conduct vulnerability assessments, they're sharing it with their neighboring health units, and that's very helpful for other health units to complete their vulnerability assessment. Now, I'm not sure if Linda has maybe shared this slide, but this shows some of the health risks in Canada from climate change. And the one thing that's quite interesting, obviously this is just a snapshot as well, so when you look at some of the impacts, you see how they're closely tied to health equity. For example, the food security in northern parts of Canada, the changing drinking water quality in northern parts of Canada. We know that in several Indigenous communities in the north already have drinking water quality problems, and that could be exacerbated by climate change. This is just an example of health equity impacts. I think Linda shared some of those, so I'll move to the next slide. So I'm going to share a couple of examples about how health units are incorporating health equity when they're addressing climate change through vulnerability assessments, through mapping vulnerabilities, through stakeholder engagement, through targeted public health interventions, through communication that's targeted to the most vulnerable, and by developing and advocating for policies that address both climate change and health equity, two examples being food security and poverty. So this is an example from Middlesex London Health Unit. So they completed their vulnerability assessment in 2014. They conducted a literature review to look at the health impacts of climate change. They then looked at their local data, meteorological data, and community health data, and they projected what extreme heat might be in the future based on the local data, extreme heat, flooding, air pollution, and vector-borne diseases. They looked at the existing adaptive capacity of individuals in their communities, and they came up with some adaptation options. Using extreme heat as an example, from the literature, it says it's identified that low-income and older adults are more vulnerable to heat. And from local data, Middlesex London Health Unit identified that the number of hot days per year have been increasing over the past several years. There's an aging population in the community, more people with chronic illnesses, low income, and people living alone. The projections were there's going to be increasing number of hot days are expected. With respect to adaptive capacity, there are local vulnerable populations that may not be prepared or have the capacity to cope with extreme heat. So Middlesex London Health Unit also proposed some adaptation options, one example being doing specific vulnerability assessments for high-risk regions or populations. Simcoe-Muskoka District Health Unit completed their vulnerability assessment in 2017. They followed a similar approach, looking at climate-sensitive health outcomes, the populations most vulnerable, and mitigative actions. This is a couple of examples of how Simcoe-Muskoka Health Unit, within their climate change vulnerability assessment, considered health equity. If we look at extreme heat, they identified that the number of extreme heat events in Simcoe-Muskoka Health Unit jurisdiction is expected to increase. They also looked at local data and identified that individuals in the lowest income category have the least access to home air conditioning, thus an increasing potential for heat-related illness. An example, availability of food. They also looked at the impact to food access that is expected because of things like extreme storms, drought, and flooding. And they recognize that individuals on low income will have the highest rates of food insecurity as a result of climate change. And this is just an example of current programs and programs that are being considered by the health unit that support vulnerable populations' adaptive capacity. Currently, the health unit has a temperature notification process to provide advance warning of extreme temperature events. And this is another thing that's new in the Ontario Public Health Standards that requires health units to respond to extreme heat and to provide some, to address it in some way. And health units have a heat warning information system that was provided by the Ministry of Health and Long-Term Care that they are using. Other ways that Simcoe-Muskoka Health Unit is addressing health equity or considering it is supporting advocacy to ensure access to drinking water for homeless, checking outdoor spaces for homeless or at-risk individuals during extreme temperature events, whether that's extreme cold or extreme heat. And they currently monitor the cost of healthy eating in Simcoe-Muskoka. Health units are also using vulnerability maps. So this allows predictions of vulnerability using a combination of environmental and socioeconomic risk factors. And it could be mapping air pollution, flood mapping, or heat mapping, but there's many other uses for these. And this is an example of Toronto Public Health heat vulnerability assessment. They map heat exposure, heat sensitivity, and heat vulnerability. An example of heat exposure would be surface temperatures in a particular area. Sensitivity would be the population and their predisposing conditions that make them more sensitive to heat. And the third, adaptive capacity, would be things like income and the housing conditions that people are living in that would make them more or less adaptive to responding to extreme heat. And this is another example of a heat map from Toronto Public Health. They also map rented dwellings in older high-rises because they noticed from their research that it is those types of dwellings that are less likely to have air conditioning and more likely to be experiencing extreme heat. Health units are also incorporating health equity into their climate change plans. Some examples from Toronto Public Health strategy. So they are considering vulnerability registries. They're researching the burden of cold-related illnesses, mapping air pollution health risks, and addressing healthy food access. Hamilton also has a climate change action plan, and one of their actions is to conduct a local community vulnerability assessment of public health impact, also support local food production, and integrate climate change mitigation and adaptation into existing food plans and initiatives. With respect to targeted public health intervention, as I mentioned earlier, the heat alert response programs that many health units are engaging in is within the Ontario Public Health Standards. So health units are doing a number of things with respect to heat alert response, issuing heat alerts, notifying community agencies of heat alerts, and collaborating on efforts to reduce health risks for vulnerable populations. It could be promoting cool spaces. It could be public health staff, public health inspectors, or other public health staff that are visiting boarding homes and residential premises during extreme heat events to see if they have a heat response program in place, and they annually review heat response plans. An example of community engagement is from Hamilton's Climate Change Action Plan. They initiated a Let's Talk About the Weather, and it was a 14-month community engagement campaign. They went out to the community, to the coffee shops, farmers markets, fairs, and libraries. I think they went to about 30 locations, and they talked to the community about how the health department and the city itself could be addressing climate change, and they got a lot of great feedback on how the health unit and the municipality need to address things like low income and other health equities that could be exacerbated because of climate change. And just my closing slide, I just wanted to reiterate, like, a lot of the work is happening at all levels on climate change, but it's really important that we do work across sectors to improve our understanding of the health impacts and health equities, and they can be the drivers to support action on identifying the vulnerable populations, targeting our health communication, and identifying adaptive measures. And I also just wanted to mention that the Ontario Public Health Association, our fall forum this year, the theme is going to be climate change and health. I expect there's going to be a lot of discussion on how we can tackle both climate change and health equity. So hopefully you'll be able to you'll hear more information about that soon. Thank you.